Your passcode has been confirmed. If you need technical assistance during your call, press *0.
After the tone, please state your name, followed by the pound sign.
I'm sorry, we did not get your name.
After the tone, please state your name, followed by the pound sign.
I'm sorry, we did not get your name.
After the tone, please state your name, followed by the pound sign. There are 18
parties in conference, including you.
Today's topic, translating research to policy. Our presenter, Dr. Shwawn Bediake, is an associate professor in the Department of Psychology at the University of Maryland in Baltimore County, where he directs the Community and Applied Social Psychology program. His general program of research is concerned with sociocultural aspects of the adult experience of sickle cell disease pain. Currently, his research examines social psychological processes that influence public attitudes towards individuals with sickle cell, the effects of sickle cell disease stigma on brain functioning, and psychoneuroimmunology. As one of the few social and community health psychologists conducting research on sickle cell disease, he is producing a unique body of work that utilizes experimental, survey, and qualitative research methods to enhance our understanding of the complexities of adult adjustment to the condition. Dr. Bediake completed a bachelor's degree in psychology at the University of Central Arkansas and received a master's degree in community psychology from Florida A&M University. He earned a doctorate in social and health psychology from Stony Brook University and was a Carolina postdoctoral fellow for faculty diversity at the University of North Carolina at Chapel Hill from 2001 to 2003. At this time, will Dr. Bediake please unmute his phone by pressing *6 to begin addressing the audience?
I guess, are you officially doing?
Okay, here we go. Can you hear me?
Yes.
Okay, thank you. Thank you so much, and good afternoon to everyone. I want to thank the Division of Blood Disorders at the Centers for Disease Control for inviting me to participate in this public health webinar on hemoglobinopathies. And I'm very honored to be among the group of very distinguished and esteemed colleagues that have provided previous seminars. It's my intent today that today's discussion can in some way contribute to expanding the discourse on research that's related to genetic blood conditions. So if we can go to the next slide. I want to thank the New Connections initiative that's funded by the Robert Wood Johnson Foundation and two individuals from the private sector, Donna Lewis Johnson and Larry Blumenthal, for the resources and expertise that they've provided to me that have really shaped my thinking about the nexus of research and policy. And last but not least, I want to acknowledge colleagues from the Departments of Psychology and Public Policy at UMBC who teach courses and conduct research on prevention and policy. Their help was very instrumental during the preparation that I engaged in for this webinar. If we can go to the next slide, please. So before we begin, I'd like to disclose that I am not a lobbyist and I'm not directly involved in the formation of any policies that we're going to discuss today. I also want to disclose that I'm a member and current chair of the Maryland Statewide Steering Committee on Comprehensive Services for Adults with Sickle Cell, and that I've consulted with the Arkansas Minority Health Commission on its sickle cell outreach and education initiative. We go to the next slide. As such, I want to be very clear that the views and opinions that are expressed in this presentation today are mine and do not necessarily reflect the official policies or positions of the Centers for Disease Control, UMBC, the Maryland Department of Health and Mental Hygiene, or the Arkansas Minority Health Commission. Can we go to the next slide, please? So now that we have these formalities out of the way, I want to get into today's topic. So many of you who are registered for this webinar work in medical settings or academic institutions or research organizations. And at some point during your career, You've heard that the work that we do needs to be policy relevant. But for those of us who do not have degrees in health policy or public policy, there's very little clarity about how we can transform our research into meaningful policy. We often take for granted that our research, albeit research that's designed with rigorous scientific methods, will have an impact on the greater public good. And we often assume that good research in and of itself yields good evidence, and good evidence in and of itself should lead to great policies. But for many of us, this publication to policy ratio remains quite low, which suggests that the process of turning our research findings into meaningful policy is not as straightforward as it appears to be. Next slide, please. So how can scientists who are engaged in cutting-edge research increase the policy relevance of their work? What are some of the areas of opportunity for scientists and policymaker interactions? How do we avoid miscommunication and maximize collaboration? So these are some of the questions that we'll begin to explore today. And because my expertise is most closely attached to sickle cell disease, most of what I'll talk about will use sickle cell as an exemplar. However, I think that the greater part of today's presentation will also be meaningful to those with interest in other hemoglobinopathies. So next slide. So I want to begin with two fundamental premises, and that is that the optimal delivery of comprehensive services for hemoglobinopathies can best be facilitated through sound, evidence-based policy. And second is that there is a critical need for enhanced partnerships among patients, researchers, advocates, and legislators to help create these sound, evidence-based policies. Next slide, please. The question of the day is, how do we get there? So assuming that we have conducted rigorous scientific research that has yielded a solid base of evidence, the question then becomes, well, what's next? So if we go to the next slide, one of the first things that we have to do is to engage in some critical thinking about politics and health services. So when we think about this relation between politics and health services, 2 points that I wanted to emphasize. The first is that healthcare professionals and researchers can influence policies that impact their population of interest. By population of interest, obviously I mean individuals who are directly affected. We will call them patients. Some will call them clients or consumers. But we have to engage in some critical thinking about this and understand that as healthcare professionals and researchers that we can influence policies that impact people's lives. And often that the change that we can create through policy potentially affects those who are inside the system, that is those patients who are directly affected, and those who are outside, and that's the general public. So by influencing policy, providers and researchers can facilitate changes not only in the experiences of vulnerable patient groups, but also in the attention that's given to neglected or ignored medical issues in the broader society. Next slide, please. So I'm going to review a process that's articulated by Felicia Mabane and Robert Blendon in a brief but informative article that they published about 11 years ago in the Journal of Child Neurology. So let's go to the next slide, please. So there are 3 steps that Mabane and Blendon identify as being very critical for influencing health policy. And the first step is to diagnose the political nature of the health issue. All right, so in this political diagnosis of the health issue, there are 3 factors that can help to determine the political resonance of an issue. So the whole idea of diagnosing the political nature of a health issue is really trying to figure out how much does this issue resonate with the political sphere. So there are 3 factors that help us determine that. The first one is public priorities, and that's concerned with how many people are actually affected by the health issue. And does the general public see this as an important issue? The second is media coverage. So how newsworthy is the topic? Is it prominently described in broadcast or news outlets? And then the third factor is how relevant is this issue to those who are part of the political majority? In other words, does the legislative majority deem this health issue as being important? Is it even on their platform? Next slide, please. So as part of a second step within the first step, or sub-step, if you will, is once we figure out these three factors, or figure out where the salience falls on these three factors of public priority, media attention, and majority party priority, then we can help to determine the overall salience of that issue. And so, as you can see on the slide here, when we look at the high salience category, according to those three factors, when the public priority sees a health issue as being a very important or top issue, when the media attention about that issue is abundant, or it's a periodic lead story in media outlets, and it's a top priority by the majority the majority party, then we can say that that category or that issue has high salience. Similarly, when we look at public priority and that there's a limited priority overall, that it may be a top priority among key segments in a particular community or context, when media attention about that issue is limited, and it seems to be a priority for leaders within a particular party or a few legislators, then we will say that that issue has medium salience. And when that issue is not on the radar at all, when there's little or no media attention at all, and it's not deemed as being important by the political party that is in power, then we can say that that issue has low salience. So once the whole point of understanding more carefully about these factors that influence the political resonance, we can come up with these salience categories, and then that is going to determine what our next step is. So if we could go to the next slide, please. So the second step becomes, once we determine how salient an issue is to understand the key political decision makers. Next slide, please. And in understanding the key decision makers, we ask ourselves three basic questions. The first one is, which government organization has the authority to make the targeted decision? One of the things that we often do in our policy and prevention courses that we have here is that we have our students actually go through the different websites that are provided by different branches of government to better understand what the role and purpose of those branches are. So those are things that we often, in many ways overlook. But a key question that we want to ask is, which government organization has authority to make this targeted decision? And we get information from government websites about the purpose and authority of government branches, about government steering committees, and about different government groups. A second question that we ask is, who is the individual, or what groups of individuals within an organization actually make the decision? And once we dig deeper in this aspect of understanding the key decision makers, our primary question, or the first question we want to ask, is, who are the individuals to actually influence this person? And then third, what are the rules of engagement? So what is the decision-making process? What is the culture of communication? When you understand who the key decision makers are and where their spheres of influence are, who influences them and who they influence, then the rules of engagement become very important to understand. So, what are the actual rules by which the decisions get made? In terms of the culture of communication, are these things that can be done electronically, or do these key decision makers really thrive on person-to-person interaction? So these are very important key decisions that we have to understand in order to influence policy. So we'll go to the next slide, please. So the third step becomes, deciding what to do. So once you determine the salience of an issue, and then secondly, you determine who the key decision makers are and what the processes are for those decisions to be made, then you start to make specific decisions about what do you want to do. Now, let's go to the next slide, please. So the whole act of going back to determine issue salience is very important because that's going to determine your major course of action. So there are specific types of strategies that you will engage in for high salience issues. And Mabane and Blendon recommend that when a high salience issue comes to bear, one of the chief strategies that you'll want to do is to develop a major proposal that then becomes publicly debated and becomes visibly debated in the media. So certain strategies that one would use would be certain public tactics that will let politicians know that their position that the position that they take with regard to this health issue has specific implications. So that's where we start to see media campaigns. You see organized efforts to create opinion or editorial pieces in newspapers or in other web-based media, blogs, for example. And you start to see more mobilization of grassroots organizations. So these are some of the strategies that are typically used for a high salience issue that is looked at as being a top priority in a particular community that has support of the majority or a party or people who are in power, and that also is highly visible in media outlets. Next slide, please. When it comes to medium salience issues, there are a different range of strategies that tend to work. The first thing that Mabane and Blendon talk about is developing, instead of these large proposals, is to develop brief proposals that are debated privately and out of the public eye. If you think about certain types of issues that seem to be relevant to special interest groups, for example, a lot of times individuals will create these brief proposals that they'll then send to a staffer of a congressperson, for example, and we'll talk about those. And so those are not really visible in public media, but they're like behind-the-scenes issues that take place, or behind-the-scenes processes that take place that engage, where individuals engage in a lot of private debate around these issues. A second strategy for medium salience issues comes about when the individuals who are trying to put forth this policy can provide legislators or chief executives, that is governors, mayors, CEOs, with information. And so in some instances, individuals will actually draft the legislation and pass that on to a legislator to consider. They will propose some of the possible policy solutions for these medium salience issues for the legislator or chief executive. And I have italicized and underlined and bolded is the idea that legislators are often provided research that describes policy implications. And usually this happens around these medium salience types of issues. A third strategy is for individuals, this is assuming that you're already mobilized and organized. A often used strategy is to rely on technical experts about the particular health issue or policy that you want to get approved, who are also constituents of the decision maker. So you'll see that happen quite a bit for these medium salience issues. And then finally, if we'll go to the next slide.
People that are interested in sickle cell.
Can we go to the next slide, please? Thank you. And so there are strategies for low salience issues. Now, low salience issues, if you'll recall, are those issues that don't seem to be on the radar. They are not visible at all in the public eye, and they don't tend to be looked at as being important by legislators and policymakers. And I'm sure that most of us who are doing work in hemoglobinopathies can identify with being somewhere in that area or in that context. So one of the things that Mabane and Blendon suggest is that for low salience issues, one of the first things to do is to not be discouraged about the lack of public interest in your issue. But in terms of strategies, there are specific things that one could do, which, as the second bullet point points out, is to become a source of information to an interested political actor. And what do we mean by an interested political actor? Would just be your representatives or political operatives who you think can be influenced if they were to gain access to this information. So usually in low salience issues, there's a lot of mobilization that relies on personal relationships and establishing personal relationships. So providers or researchers can become a source of information to interested political actors by sending them reviews that they have come across, by sending them summaries of their own research or the research of others who are relevant to that policy. And then third, providers or researchers can also establish relationships with journalists who cover health issues and to make those journalists aware of policy-relevant research. I think if we can think back to about maybe 6 or 7 years ago, there were a lot of stories in what I call human interest stories that were being published in newspapers across the country about the experiences of adolescents with sickle cell disease. And it's like once one journalist actually wrote a story in California, for example, then another journalist would write another story in Texas. And so these journalists started kind of looking around for teenagers with sickle cell disease, and were trying to get more information about what their lives were like. And that was an issue that then became, even though it was a low salience issue, it also became more prominent in the public eye. So the next slide, please. So when you keep these things in mind, these 3 steps, first, engaging in a political diagnosis of the issue, second, understanding the key decision makers, and then third, deciding about specific strategies that one wants to engage in. There are some caveats that are listed there that Mabane and Blendon also point out in their article. The first one is this idea that politics is definitely not for the faint of heart. Again, most of us on this call are people who have advanced degrees and have gone through rigorous scientific training and rigorous clinical training, but politics is not for the faint of heart, because it essentially is all about conflict and how to manage conflict. And the second thing that's very interesting, and this is something that I've found to be true in my own experiences, is that individuals, when you think about a political issue where there is conflict, people have to choose sides. And the thing that's very interesting is that even though you may feel that you are in the right and that your efforts are noble and worthy, individuals who may feel threatened by that will often fight back, and they will fight back with a vengeance. And so you have to be somewhat prepared when you engage in or make that foray into the political arena. And then the second thing that's very important is that words are very powerful. So when we say words are powerful, what that basically entails and what Mabane and Blendon highlight is the idea that how you describe an issue is ultimately what's going to determine how effective these strategies are. So how one describes an issue determines its effectiveness. And then secondly is that everyone should have a clear message about the problem and the solution. And by everyone, we mean everyone who is on the same side of a particular issue. We've often seen sometimes where different groups of constituents come together and rally around the same cause, but if everyone has a different message, then it dilutes the effectiveness of the message. So it's very clear, very important to have a clear message both about the problem and the solution, and that everyone should be on board with that. So politics is not for the faint of heart. It's essentially about conflict. We have to be prepared that those individuals or groups or constituents who feel threatened about the particular policy that is being proposed will fight back. And then importantly, thinking or being mindful about the fact that words are powerful and how you describe the issue is going to determine its effectiveness, as well as getting everyone on board and making sure that there is a unanimous consensus in the message, both about the problem and the solution. Right. So next slide, please. So when we think about this, and I wanted to kind of cut the presentation part of this a little bit short, just so we can have an opportunity to discuss more about for those who may have more specific things that they like to discuss, we can talk about those. But when we think about hemoglobinopathies and hemoglobinopathy research, there are particular areas that present some interesting opportunities and challenges for translating research into policy. And if you go to the next slide, please. I've reviewed the National Conference of State Legislators website, and again, since my experience is most closely aligned and attached to sickle cell disease, this particular website lists all the sickle cell relevant legislation in about 14 states. But the list that they have is neither exhaustive nor is it updated. It doesn't appear that it's been updated since 2006. And if you look at most of the policies and legislation that has been passed with regard to sickle cell disease, it's mostly focused on 5 areas. And so there's been policies that establish commissions and task forces. There have been policies or legislation passed legislation that has passed laws against discriminatory practices towards people with sickle cell, either in education or employment arenas. There's legislation that mandates support for screening and testing for sickle cell trait in certain states. And there's some legislation that has been concerned with the existence of public health education around sickle cell and with public assistance programs for individuals who are directly affected by sickle cell disease. And so what we see here is that there's a great deal of opportunity, because there's most of the sickle cell relevant legislation that has been passed primarily is focused in quite narrowly, I would think, in my opinion, in some pragmatic areas, but there's a lot more that we could possibly be doing. So if we go to the next slide, I've just listed a couple of areas where there's great potential for policies that are relevant to blood disorders. The first one is what's perhaps been on everyone's mind in this current political season is the Affordable Care Act and the specific policies that may affect individuals with genetic blood disorders in general, those with sickle cell in particular. The second is the sickle cell trait policy that's recently enacted by the NCAA. And although that does seem to affect only college student, or seems to affect college student athletes, as the article that came out that was led by Vince Bonham and colleagues suggests that this sickle cell trait policy actually does constitute a very interesting social experiment about how we look at trait conditions and how we look at genetics and how people perform in the workplace. There's policies that have come up that are proposing placing limits on hospital readmissions or reimbursements for certain medical services that are offered. There's policies that have proposed legislation that's coming up that's looking at whether or not there should be particular limits on non-emergency hospital stays, policies related to educational and workplace discrimination, and policies that have come up. I think the state of Arkansas, for example, passed last year a piece of legislation that established a comprehensive clinic for treatment of sickle cell in that state. And so there are several different areas of opportunity for researchers who, or for those of us who do research in hemoglobinopathies, to actually, find some ways to provide a sound evidence base for, a sound evidence base that can then be distributed or disseminated amongst our decision makers in order to make efficient and effective policy. So if I go to the next slide, please. I want to start to wrap up a little bit by just focusing on some other key points that researchers and those who provide clinical services may need to consider when thinking about this whole aspect and process of translating your research into policy. And these are by Mary Beth Shin in an article that she published in 2006, I believe in the Journal of Community Psychology. And one of the things that she pointed out was that the importance of understanding that individual leaders do matter, that there's often a two-way relationship, that our elected officials often create opportunities for researchers. And so, there are some people who feel uncomfortable, again, because of the lack of training that we've had in, engaging with the political sphere. Most of us feel that we just want to do research and leave it at that. But we have to understand that individual leaders do matter. And so in some ways, who is in power and, what their particular likes and dislikes may be will determine the level and the number of opportunities that get created for researchers to have an opportunity to affect change in the policy arena. The second thing is that timing matters. So often it's those chance events that highlight particular types of work that we do. And that, but when we also think about timing and the importance of time in the research to policy process, is that research needs to be available when it is needed. Oftentimes when we look at some particular social problems, the thing that I find to be quite interesting about it is that, whenever a particular health issue or social issue pops up, research is not needed 3 to 4 years down the line from that. That research should already be done and be published and be available when it's needed. So timing is also of the essence. And then third is this idea that ideas themselves matter. So policymakers are often not concerned with the grand theories that many of us as researchers often operate within. And so we have to be ready to act. Politicians, for example, and policymakers are ready to act on the basis of science and evidence. So ideas are very important and they do matter. Next slide, please. So costs also matter. So governments are particularly sensitive to cost and benefit ratios, and they are typically more concerned with the short term than the long term. So another thing that is often a point of contention for researchers who do policy work is that often we are trained to sort of build a program of research where over time we arrive at what we consider to be truths about the work that we're doing. Whereas for politicians, they're not really thinking that much about long-term benefits, but more with the short term. Another key point is that government is not monolithic, and that there are some particular agencies that may be more receptive to science and scientific research, and that different agencies have different goals. So, we often can't just talk about the governmental agencies in one broad stroke as if, just because they're a government agency, they're going to be more difficult for us to deal with, or that they're going to be even, friendly or amenable to many of our ideas. But, we have to understand that there are some government agencies that are more receptive to science than others. And depending on the goals of that agency, they will have different goals. And then finally on this particular slide is the idea that that data may be used for different purposes. So another thing that many scientists will have to come to grips with or come to accept when you start in this political arena or policy arena is to understand that, you can't control how your data gets used. So once you put it out there, and again, when there are competing sides, sometimes they can take the same data and just come to entirely different conclusions than what it may have been intended. And so for some scientists, that's very difficult to think about or to contend with. But that's just a key point to keep in mind here. So the next slide, please. I just wanted to kind of go back and reiterate the fundamental premises that I wanted to start with, that in my case, with the work that I'm doing in sickle cell disease and thinking more carefully about how comprehensive services get offered, the optimal delivery of these comprehensive services, in my opinion, can best be facilitated through sound evidence-based policy. And when I say that there's a critical need for enhanced partnerships amongst patients, researchers, advocates, and legislators, is that there is a need for all of us to talk more with one another. Some individuals who have particular gifts and skills in certain areas don't necessarily have to do everything themselves. So if you're a researcher who is studying an issue that has a high public policy priority, it's not necessary for you to engage in the research to policy process. But what's more important is that there be some sort of communication so that all of the stakeholders can sit down, and that there needs to be some mode of communication so that we can all inform each other's efforts. Next slide, please. So I want to thank you. I'm just going to end with the formal part of the presentation there and open the floor so that we can have some adequate time to sort of discuss some of these things, some of these issues. Thank you.
Thank you. We'll now open the lines for questions. Please remember to unmute your phone individually by pressing *6. And if you have a question, raise your hand electronically, and your names will be called in the order in which they're received. We only have this line scheduled for about an hour, so I'll need to end this session when we reach that time point. But if you have your questions, go ahead and raise your hands now. Is it Tia? Tia, do you have a question? Might be on mute.
Remind her how to unmute her phone.
If you need a reminder on how to unmute your phone, you press *6. And then for those of you who need a reminder on how to raise your hand, you just click on the Q&A tab on the menu bar of your screen, and in the Q&A window, click on the hand icon up in the upper right-hand corner.
Little hand.
Q&A. Oh, Q&A up top.
Where do you
Y'all
see
see it?
The bar, yeah, to the left. Yep.
This is Althea. I'm going to ask a question while we wait for folks to raise their hands.
Sure, sure.
Do you have any good examples of someone actually, getting a lot of traction with a low salient issue, how people maybe have used some of the strategies you talked about and actually been successful?
Right. And so one of the things that I could give as an example, I think, would be the passage of the act that was enacted in Arkansas this past year, or actually last year, so April 1st of 2011. The state legislature actually unanimously passed a bill that established a comprehensive system for treating sickle cell in the state of Arkansas. Now, that was a very low salience issue in a way because they're not, compared to other parts of the country, there's not a lot of people with sickle cell in the state of Arkansas. But for those individuals who are directly affected, they, sort of mobilized. So they brought together both community-based organizations, the Minority Health Commission, certain legislators who had personal experiences with individuals who were directly affected by sickle cell, and they all came together and kind of mapped out what would have what needed to be done in order to help people have an optimal and meaningful quality of life. One of the ways that they approached that was by focusing on the cost of care for hospitalizations for sickle cell. And if they could, and so everyone was in agreement again with the message that a comprehensive center would be better able to more effectively treat sickle cell as opposed to the existing medical infrastructure. And they showed exactly how much that would save the state in healthcare expenditures. So while that was going on one end of the spectrum, on the other end of the spectrum, there was a public health campaign to get individuals more knowledgeable about what sickle cell trait entails, so that could be a segue to help people understand what sickle cell disease was. Okay. And so you had the materials that were developed by the state of Connecticut. I'm blanking on the name of it now. The public health campaign materials that they had. I'm sorry, I don't know why I'm blanking on that, but it was about, do you know, there's a lot that you don't know about sickle cell disease. And so those materials were shown on TV. They had a print media campaign, and so they had people in the state, more broadly, just talking more about sickle cell trait and why it's important to know your sickle cell trait status. And so it created then this sort of environment where a low salience issue actually began to develop traction. And once it reached the legislature and this bill was introduced, then the legislators themselves were also dealing with an informed populace who also were in support of having a system in place to help more effectively treat people with sickle cell. And again, we go back to the issue where timing is important. Again, this was all taking place during the summer of 2009, 2010, which, as we can recall, was a summer when everybody was talking about healthcare costs and healthcare expenditures. So that's an example, I think, of where that comes from in terms of the mobilization part. But what I think was very important was that a lot of the legislators actually talked with individuals who were in other branches of other health-related organizations in the state, and they did a very good job of actually summarizing the current state of research, and they used and cited a lot of the published research as the rationale behind this bill.
Thank you.
Okay, I think we have another question from Shay. Shay, are you on the line? I guess not. Let's go with T. Moulton. Is there a T. Moulton that had a question?
Can you hear me?
Yes.
So I just wanted to point out that while it was important that Arkansas did legislate for like a comprehensive center, they didn't fund it.
Right. Well, and that's a very good point that you make. And actually, to be honest, that actually is not uncommon with a lot of sickle cell legislation. So but if you think about it from the political capital perspective, it's an important first step, because then people will actually have to go back if they can sustain that effort, which I think is the primary challenge, is to then go back and then to demand for that funding for those services and programs. But you're very right. In fact, I think the bill that was passed in 2005 was actually unfunded at the national level for quite a while through the federal government. So, and that's one of the things also to keep in mind about the policy aspects is that politics makes strange bedfellows, but also sometimes politics doesn't make complete sense. And so for those of us who are not in the policy arena, in the political arena, some would look at a law being passed but being unfunded as a failure, whereas those who think about this over the long haul would look at it as an important first step. So I think that's your comment is right on point.
Thank you. Are there any other questions? Remember to press *6 if you're trying to unmute your phones. Any other questions from the audience? If not, we'll end early. We had a few more minutes. I want to thank Dr. Bediake very much for this very informative presentation. We appreciate it. The next webinar will take place on Thursday, September 27th on improving quality of care for sickle cell pediatrics in the emergency department with Dr. James Moses of Boston Medical Center. If you have any questions, please feel free to contact Shay Pope at spope@cdc.gov. And the recorded webinars are made available at scinfo.org under the webinars toolbar. Thank you all for participating. Have a great day.
Thank you.
Thanks.
Bye-bye.
Bye.
Thank you.